నిరుద్యోగులకు అంట మన లెజెండ్ అతి తక్కువ ప్రైస్ లో స్టేట్ బెస్ట్ ఫ్యాకల్టీతో చెప్పించిన క్లాసులను అందిస్తుంది లెజెండ్. SAPC మెయిన్స్, గ్రూప్ 4 2 పేపర్స్, DAO పేపర్ 1 2, గ్రూప్ 2 3 4 పేపర్స్. ఏ కోర్స్ అయినా తక్కువ ప్రైస్ లో మీకోసం ఎప్పుడైనా ఎన్నిసార్లైనా వినొచ్చు. డౌన్లోడ్ ఆప్షన్ కలదు. జస్ట్ మీ మొబైల్లో ప్లే స్టోర్ నుండి లెజెండ్ క్లాసెస్ యాప్ డౌన్లోడ్ చేసుకోగలరు. 2 తెలుగు రాష్ట్రాల్లో అత్యధిక మంది అభ్యర్థుల ఎంపిక మన లెజెండ్. మీరు లెజెండ్ తీసుకోండి, జాబ్ సాధించండి.
The topic under discussion is heart failure. When does heart fails? This is also the other name for heart failure is congestive cardiac failure. Okay, the other name for heart failure is also called as congestive cardiac failure. Why does the heart fails? Okay, when the heart doesn't pump the required blood to the muscles of the heart, then it fails. Okay, when it is not done by itself, when the heart is not pumping the enough blood to the muscles by itself, then the heart leads to fail. Okay, and then another one, when the heart doesn't allow or doesn't pump the enough blood or the required blood, when it is not pumped by the heart to the auricles and ventricles. First, the 4 chambers will be filled in the diastole. After that, through the ventricles, the blood is ejected from ventricles to the arteries. It may be pulmonary, it may be aorta. Okay, this is called systole and diastole. Filling these 4 chambers is called diastole, and ejecting the blood from the ventricles to arteries is called systole. Because to flow the blood from the 4 chambers, through the chambers there will be less force. To flow the blood from the lower chambers to a higher section, see these ventricles are in a lower section. To pump the blood to the higher region, there need to be a force is necessary to push the blood. That is called ejection of blood. It is the right part of the heart is having the deoxygenated blood from ventricles. This deoxygenated blood has been carried through the pulmonary artery with the help of these valves. Okay, here the oxygenated blood has been transported or carried through the help of ventricles when ejected through the aorta. Okay, when this heart is not able to pump the sufficient blood to the auricles and also ventricles, why it is not doing? Because the valves of the ventricles become hardened or swollen. When swollen or when bulged, okay, when bulged or when swollen, the space become constricted, means the space become very low space will be there to pump these ventricles. Okay, contraction and relaxation. To have contraction and relaxation mechanism, there is only a few space for these ventricles. Okay, and also when to receive blood means diastole, to receive blood and also to eject the blood, there is a slow movement in these ventricles in heart failure. Okay, then we'll going to see the definition is meaning when the heart does not pump required blood to heart muscles, or it may be body by what it should. Okay, the work of the heart is to pump the blood, okay, by itself, but it is not pumping because the walls of these valves has become harder and also thick. So there is a slow mechanism in between these ventricular contraction and relaxation. Okay, next we are going to see regarding symptoms. We have studied regarding the meaning and the definition of heart failure, and the symptoms is ventricular fibrillation. Okay, SOB, fatigue, dizziness, loss of alertness, okay, and sweatings, increased or decreased heart rate, it may be tachycardia or bradycardia, okay, and murmuring sounds has been seen as a symptoms of this heart failure, okay. Ventricular fibrillation means there will be no coordination within the ventricles and with the auricles. In the ventricular fibrillation means there will be no coordination within ventricles, means for contraction and relaxation there will be coordination, no, then the coordination is lost within the ventricles and with the auricles, okay. For pumping of blood, for the mechanism of heart, the auricles and ventricles should be in a coordinated, no, in a coordinated way, then the heart can pump, be healthy and can pump blood very easily, okay. And when ventricular fibrillation occurs, the coordination in between these ventricles, within these ventricles will not be coordinated, and with the also auricles there will be no coordination. So heart rate increases and rhythm disturbances occurs. Rhythm disturbances occur and blood flow decreases, okay. Rhythm disturbances may occur, heart rate may be increased and also blood flow also reduced or decreased with this ventricular fibrillation. Next one, SOB. Patient will be having shortness of breath in all cardiac diseases what we have studied in the previous classes even, okay, and also the first main sign, and also pain in the chest region. Fatigue means tired, faint, loss of consciousness, dizziness. Sweatings will be seen when the patient is having heart failure, and also irregular heartbeat, and also murmuring sounds from the heart we can listen. Next thing, symptoms. Symptoms has been seen. Causes. What may be the causes? Increased BP due to increase of blood sugars, due to increase of hypertension, heart rate, or increase of body weight, genetical factors, means hereditary. If their parents are having, then the daughters or son may have same the genetical factors, okay, that is hereditary. Or having habit of alcohol and tobacco, okay, and also previous history of heart problems and atherosclerosis, okay. Causes: increased BP if the patient is having hypertension, okay. Hypertensive patient can have heart failure, okay. Why? Because there will be more pressure in the flow of blood. The patient who is having high BP, due that the blood vessels or the walls of blood vessels will be ruptured and leads to heart failure. And also blood sugars, increased of glucose levels in the blood can leads to heart failure. And also heart rate. How does the heart rate increases? When there is irregular or also increased heart rate, when means forcefully pumped, contraction and relaxation is forcefully moved, then it leads to increased heart rate. It means tachycardia. Okay, then if the body is overweight, means obesity. Okay, genital factors means hereditary. Okay, if the parents are having same heart problems or heart failure, then their sons and their sons will also get, son-in-laws also, or grandsons will also get. Okay, alcohol and tobacco, patient who is addicted to alcohol and tobacco, patients will also get heart failure, and history of any heart problems can lead to heart failure. Okay, and atherosclerosis means build-up of fat in the walls, at the walls of the arteries, can lead to heart failure. Why? Because this fat content which is present at the walls of arteries build up more, because becomes more, and because of high levels of cholesterol when present in the body leads to build up more cholesterol at the walls of the arteries. These makes to disturb or interrupt the flow of blood to rest of the muscles of the heart. Okay, when there is lack of blood flow to the muscles of the heart, it leads to heart failure. Okay, next one, we are going to see the diagnostics findings which can detect the heart failure. First one, ECG. Next, 2D echo, angio, severity, location, how many arteries have been blocked. This will be seen in angio. Okay, this will be seen in a angio. How much is the severity? Where is the location in the arteries? It may be pulmonary artery, it may be carotid artery. Where is the location? And how many arteries have been blocked? How many arteries are interrupted with, okay, and doesn't allow the interruption which is not allowing the blood to flow. Those are known through the angiogram. Next, what is the treatment for these? When a heart gets failure, after the patient is having heart failure, then the first treatment is CPR. We have already discussed regarding CPR in the past classes. Okay, CPR means cardiopulmonary resuscitation, means giving the life back within 4 to 10 minutes. Means putting on compressions within the heart on the chest region. By putting compressions forcefully, then the impulses, the electrical impulses will give the heart to regulate, and to mechanism or the function has been reverted. Okay, to revert the mechanism, the compressions has been given. Okay, through the help of carotid artery, the blood will be carried to the brain, and the brain also get back. Okay, that is CPR. And also after that, even after giving the CPR, if the patient doesn't get reverted, patient condition doesn't get reverted from heart failure, then defibrillator is used, where sinus and SA nodes and AV nodes are not giving any electrical impulses to heart. These defibrillator, it has two paddles. Okay, it is an electrical device. It has two paddles. By putting pressure on the chest with the help of gel and also leads, by putting compressions or putting pressure, shock, electrical shock. Okay, that is artificial electrical impulses which are sent by the defibrillator. Then it makes the heart to make revert or they restore the rhythm of the heart. Okay, by that the patient can get back or can restore the rhythm and also heart rate. Okay, the treatment medication is